Hello, I'm Dr. Trainor. Today I want to talk about carotid artery disease, what it is, why it matters, and how managing it can help prevent stroke. The carotid arteries are two large blood vessels on each side of your neck. They bring blood rich in oxygen to your brain. When plaque builds up in the arteries and causes a narrowing or blockage, it can lead to a stroke. Carotid artery disease is one of the main and most serious causes of ischemic stroke, the most common type, caused by reduced blood flow to the brain. But the good news is, if we catch it early, it can be managed through healthy lifestyle changes, medications, and sometimes procedures. Let's talk about how to protect your brain. Carotid artery disease happens when fatty deposits called plaque build up in the carotid arteries. This is known as atherosclerosis. As the plaque builds, it narrows the arteries and reduces blood flow to the brain. This narrowing may also be called stenosis. There are two main ways that this can cause a stroke. First, a clot or piece of plaque can break loose, travel to the brain, and block blood flow. Second, the artery can become so narrowed that it cuts off oxygen supply to part of the brain. We measure how narrow the artery is in percentages compared to the normal size of the blood vessel. If the narrowing is mild, less than half narrow, we usually treat it with medication and lifestyle changes. If it becomes more severe or causes a stroke, a procedure may be needed to restore normal blood flow. One challenge with carotid disease is that it often develops with no symptoms. Many people don't realize they have it until they experience a stroke or transient ischemic attack, also called a TIA. A TIA causes stroke-like symptoms that go away on their own, but it's a warning sign of a possible stroke and should be treated as an emergency. Some people with carotid disease may have symptoms that come and go before a full stroke happens. To learn more about symptoms, watch our other video called Recognizing Stroke Symptoms and Acting Fast. Carotid disease is often found during routine checkups or after someone has had a stroke or TIA. If your VA healthcare provider suspects carotid disease, they may order tests to check for blood flow and look for plaque buildup. These tests may include a carotid ultrasound, which uses sound waves to measure blood flow and find narrowing, or CT or MR angiography, which are detailed images of the carotid arteries. In some cases, a carotid angiogram may be done, in which the doctor injects contrast dye through a catheter placed in your blood vessels to very accurately show any blockages in the arteries. If you have carotid disease, managing risk factors is key. Lifestyle changes can slow or even reverse the buildup of plaque. Important changes include controlling high blood pressure, lowering cholesterol, eating a heart-healthy diet, exercising regularly, quitting smoking, and managing diabetes. These habits don't just help your carotid arteries, they improve your overall health and lower your risk of stroke. You can learn more in our video, Lifestyle Changes to Prevent Stroke. In addition to lifestyle changes, medications are often used to prevent stroke in people with carotid artery disease. Your VA healthcare provider may prescribe antiplatelet medication like aspirin or clopidogrel to prevent blood clots, statins to lower LDL cholesterol and stabilize plaque, and medications to keep your blood pressure in a safe range. It's very important to take all medications as prescribed. If you ever have concerns about side effects, talk to your provider before stopping or changing any medication. If the narrowing in your carotid artery becomes severe or leads to a stroke, a procedure may be needed. The two main procedures used include carotid endarterectomy, which is a surgery to remove plaque from the artery, and carotid artery stenting, which places a small mesh tube in the artery to keep it open. The decision to have a procedure and the type of procedure depends on how narrow the artery is, whether you have symptoms, and your overall health. Your care team will work with you to decide the best treatment. Preventing stroke from carotid disease starts with early detection, continues with managing risk factors, and includes getting the right treatment when needed. If you've been diagnosed with carotid disease, work closely with your VA healthcare provider to monitor your condition and adjust your care plan as needed. And if you had a TIA or stroke but don't know your risk, ask your provider to review your test results with you so you can take action to protect your brain. Thank you for watching. If you have questions about carotid disease or stroke prevention, reach out to your VA healthcare provider. You can also visit stroke.org for more information. Take action today and protect your brain.